Welcome back. I'm an emergency doctor actively working at the emergency department of my hospital. In this Doctor's Corner series, we'll dive into lesser-known approaches and hidden strategies to help the people with critical illnesses. You can subscribe if you want to learn the latest news and healthy solutions about your health. Listen carefully. When premenstrual symptoms appear, do not treat water as a small detail. Treat it as one of the first body signals to manage. Why? Because PMS is not only mood before a period, it is a whole body response involving the brain, hormones, blood vessels, kidneys, digestion, sleep, appetite, pain sensitivity, and fluid balance. The American College of Obstetricians and Gynecologists describes premenstrual disorders as conditions that may require a multimodal approach, including education, self-care, nutritional strategies, exercise, psychological care, and, when needed, medical treatment. So begin with this idea. Drinking water is not a cure-all, but it can become a powerful supporting tool when used correctly. Now ask yourself, why would something as ordinary as water matter during the days before menstruation? How can drinking water help when the body already feels swollen, heavy, and bloated? This is where the body seems to contradict itself. Many people think, if I feel puffy, I should drink less. Do not follow that instinct. Pause. Think physiologically. When the body senses low fluid availability, it may defend itself by conserving fluid more tightly. The kidneys, blood vessels, and hormones begin behaving as if supplies must be protected. That can make the abdomen feel fuller, the hands or face feel puffy, the breasts feel more tender, and the whole body feel heavier. So make this your first command. Do not wait until you feel thirsty. Start earlier. In the week before menstruation, drink water deliberately, steadily, and calmly. Do not flood the body all at once. Sip across the day. Build rhythm. Let the body receive the message. There is enough fluid. You do not need to hold on so aggressively. To understand why water can help, first understand what PMS often includes. PMS can involve abdominal bloating, breast tenderness, headache, swelling, food cravings, fatigue, poor concentration, irritability, anxiety, low mood, and sleep disturbance. A recent JAMA synopsis of ACOG guidance explains that premenstrual disorders may involve luteal phase estrogen fluctuation, serotonin dysregulation, and sensitivity to allopregnanolone, a progesterone metabolite. In simple language, the brain and body are reacting to normal hormonal motion with an amplified signal. Why does this matter for water? Because water sits at the crossing point of several PMS pathways. It influences blood volume, it influences kidney signaling, it influences bowel movement, it influences temperature regulation, it influences how the body handles sodium. It may even interact with stress biology. So when we talk about drinking water for PMS, do not imagine water merely washing symptoms away. Imagine water helping the body reduce unnecessary alarms. Now look at bloating. Bloating before menstruation is not always fat gain, and it is not always overeating. Sometimes it is delayed digestion, sometimes it is gas, sometimes it is fluid shift, sometimes it is sodium sensitivity, sometimes it is breast and tissue swelling. One study examining edema distribution in PMS noted that water retention type symptoms may include swelling, breast tenderness, bloating, and weight gain, and described premenstrual edema as especially linked with the second half of the cycle when progesterone is dominant. So ask, how does water help bloating if bloating is partly fluid? Here is the key. Good hydration can support sodium balance and kidney flow. When sodium intake is high and water intake is low, the body may hold water in a way that feels uncomfortable. When water intake is steady, the kidneys are better positioned to excrete excess sodium and maintain a smoother internal balance. That is why many clinical resources advise reducing salt for premenstrual water retention. It is not only about drinking more, but about helping water move through the body properly. Mayo Clinic also lists reducing salt, regular exercise, sleep, and in some cases prescribed diuretics as approaches for premenstrual water retention. So do this. Pair water with sodium awareness. Do not drink water while eating very salty foods all day and expect magic. Reduce salty snacks, instant noodles, processed meats, packaged chips, and heavy sauces during the late luteal phase. Then drink water regularly. Why? Because water works best when it is not fighting a constant sodium overload. Now consider pain and menstrual distress. PMS and menstrual cramps are not identical, but they often overlap in real life. A semi-experimental study in young women with primary dysmenorrhea found that regular daily water intake of about 1.6 to 2.0 litres was associated with reduced menstrual pain severity, shorter bleeding duration, and less use of pain relief medication. Be careful. This was not a perfect double-blind trial, and it studied dysmenorrhea rather than PMS alone, but it still gives us a meaningful clue. Hydration may influence menstrual discomfort in ways that many people underestimate. How might water affect pain? Think about circulation, muscle function, and inflammatory signaling. Dehydration can make tissues feel tighter, headaches more likely, and fatigue more intense. Poor hydration may also worsen constipation, and constipation can amplify pelvic pressure. If the bowel is sluggish before the period, and progesterone can slow gut movement, then the abdomen may feel stretched and tense before bleeding even begins. So give this command: protect the bowel before the period. Drink water, eat fiber, walk after meals, and do not let constipation quietly increase pelvic discomfort. Now ask another question. Why do some people feel emotionally worse before the period when they are underhydrated? The answer is not only psychological. Hydration and stress hormones appear to share biological pathways. A 2025 study in the Journal of Applied Physiology reported that adults with habitually low fluid intake and signs of suboptimal hydration showed greater cortisol reactivity during acute psychosocial stress. That does not prove water treats PMS mood symptoms, but it opens a clinically interesting window. During a phase when mood circuits may already be sensitive, low fluid intake may add another stress signal. So do not separate the mind from the body here. If someone says, "I feel anxious, heavy, foggy, and irritated before my period," do not answer only with willpower. Ask, how much water did you drink today? How much salt? How much caffeine? How much sleep? How much movement? These are not small questions. They are entry points into the chemistry of the body. Now let us go deeper into the kidney signal. When fluid intake is too low, the body may increase systems designed to preserve blood pressure and fluid volume, including vasopressin and the renin-angiotensin-aldosterone system. These systems help retain water and sodium when the body senses risk. That is protective in true dehydration, but during PMS it may contribute to the feeling that the body is holding on to everything. Physiology literature describes how vasopressin, renin-angiotensin activity, aldosterone, and stress hormones act to conserve sodium and water or redistribute fluids when the body is trying to maintain critical circulation. So how should you drink? Do not make it complicated. Use a simple late luteal hydration plan. First, start 5 to 7 days before the expected period. Do not wait for symptoms to peak. Prevention is easier than rescue. Second, drink in divided amounts. Take water after waking, between breakfast and lunch, mid-afternoon, early evening, and with medication or supplements if you use them. Do not force large volumes at night, because waking repeatedly to urinate can damage sleep, and poor sleep can worsen PMS. Third, watch your urine color. Aim for pale yellow most of the day. If it is dark and concentrated, drink. If it is completely clear all day and you are urinating constantly, reduce the pace and consider electrolytes through food. Fourth, do not overdo it. More is not always better. Excessive water intake can dilute sodium in the blood, especially when combined with certain medications or medical conditions. If you have kidney disease, heart failure, liver disease, uncontrolled endocrine disease, or take diuretics, SSRIs, antiepileptics, or other fluid-affecting medicines, speak with a clinician before making major fluid changes. Fifth, combine water with minerals from food. Add potassium-rich foods such as bananas, oranges, potatoes, spinach, beans, yogurt, or avocado if appropriate for your health status. Add magnesium-rich foods such as nuts, seeds, legumes, and dark leafy greens. ACOG patient guidance notes that magnesium may help reduce water retention, breast tenderness, and mood symptoms in some people. Now ask, what about special waters? One randomized controlled trial studied hydrogen-rich water in women with PMS and compared it with placebo water, with participants consuming about 2 liters per day during the intervention period. The study evaluated premenstrual symptom scores and quality of life over several cycles. This does not mean everyone needs hydrogen-rich water. The more grounded message is this: researchers are paying attention to water as a biologically active behavior, not just a wellness slogan. So keep the recommendation clean. Start with ordinary water. You do not need luxury bottles. You do not need complicated rituals. You need consistency. If plain water feels difficult, add lemon, cucumber, mint, or drink it warm. If nausea is present, take small sips. If cravings are strong, drink water before reaching for salty food, then decide. Do not use water to punish appetite. Use it to clarify appetite. Now, here is a point many people miss. Drinking water is also a tracking tool. Tell the audience this clearly. Track your symptoms for at least 2 cycles. ACOG guidance emphasizes daily symptom recording for diagnosis and management of premenstrual disorders. So write down water intake, bloating, breast tenderness, headache, mood, cravings, sleep, bowel movement, and bleeding start date. Why? Because PMS is cyclical and patterns reveal what memory hides. Use this method. For 2 months, increase water steadily during the week before the period while reducing excess salt. Then observe. Did bloating reduce? Did headaches ease? Did constipation improve? Did breast tenderness change? Did fatigue soften? If yes, keep the habit. If no, do not blame yourself. PMS is complex and water may be only one piece. Also say this with medical clarity. If symptoms are severe, disabling, or linked with depression, panic, rage, hopelessness, or inability to function, do not rely on water alone. Seek medical evaluation. PMDD and premenstrual exacerbation of other conditions can require evidence-based treatment, including SSRIs, hormonal options, cognitive behavioral therapy, and other clinician-guided approaches. Water belongs in the foundation. It is not a substitute for care when the condition is severe. So bring everything together. Why can drinking water help with premenstrual symptoms? Because PMS often involves fluid shifts, bloating, breast tenderness, digestive slowing, headache, fatigue, stress sensitivity, and sodium water regulation. How can water help? By supporting kidney clearance, moderating sodium concentration, protecting bowel function, improving circulation, reducing dehydration-related headache and fatigue, and possibly lowering the extra stress signal that poor hydration may add to an already sensitive phase. Give the body a steady message. Do not starve it of fluid and then wonder why it clings to fluid. Do not wait until the symptoms are loud. Begin early. Drink steadily. Reduce salt. Move gently. Sleep seriously. Track honestly. And when symptoms are severe, ask for medical help without delay. Remember this final line. Water is not dramatic, but the body often responds beautifully to what is steady, repeated, and timed well. Take care of yourselves and of one another. We are learning this together like a family that wants everyone to feel better informed and better supported. See you in the next topic.